Hey, it's Jessica with Bodify Academy. We are so excited to walk you through another assessment and treatment plan and then show you this client's final results after 2 rounds of CoolSculpting. So this woman came to us, she presented with a aggravation and frustration, particularly with her abdomen. So that is the area of opportunity that we assessed for her. And here is her original photo. So as we do with all clients who are going to be treating their abdomen, we always want to mark the oblique lines. So the reason that this is important is you want to make sure that you are completely treating all of the fat that is inside those oblique lines, because if you're missing any of that fat, it's left behind, and what we know is often the fat that is left behind ends up frustrating people more than the fat that was removed. Something I did want to mention with this photo as well, it's really important because people are doing virtual consultations, that when you're assessing someone, if you're doing it virtually, we just think it's really important to kind of have a standard clause that says, look, when you come in, for some reason, if your treatment plan needs to change in order for you to get the best result, we just need to be a little bit flexible. We have certainly had people that appear to be either larger or smaller than they are virtually, and when they come in, the treatment plan does need to change, so we just think it's a really wise decision to kind of cover your buns when you're doing virtual consults and let people know that you are committed to getting them the best result, and for some reason, if there's a misrepresentation visually over a virtual consultation, that you of course are going to change that plan to ensure that they get the best and most beautiful transformation. So after we mark those obliques, then we're going to look at where the peaks of the fat are. You always want to mark every single peak, because every single peak means you're going to be using a different applicator or an additional applicator. So in this case, because she has 4 peaks, we know we can't use 2 applicators. We are actually going to be using 4 applicators, and now we have to determine which applicators are appropriate in order to make sure we're covering the full length and width of her fat pad and leaving her with a beautiful reduction. So the next thing that's really important is to draw with the natural taper of the fat pad. A mistake that we often see new people make is that they don't really find the correct orientation of the fat pad, and as you'll see later on in this presentation, if you don't do that, then you can actually be treating areas that don't really need to be treated. You could be missing the peak of the fat, or you could be not treating areas that need to be treated. So something else that I wanted to point out, when we talked to this client, she articulated that she was not wanting that lower lip to lift, she wanted it to flatten. And that's why we drew the peaks here. If the client had said, guess what, I really want a lift of that lower lip, then we would have made sure that we marked the peaks here, because that would have been the center of the fat pad that we were trying to get the most dramatic reduction. But because we had that conversation with her, we were able to build a treatment plan that was going to achieve her desired outcome, which is also important to pay attention to your clients and what they're hoping to achieve, so that way you make sure 4 months down the road that the clients are happy with their outcome. So I mentioned this a little bit earlier, but let's say that we decided to use the plus, and instead of using an applicator for every peak that we mark, and instead of marking those oblique lines, we just said, guess what, we're going to put a plus on the upper abs, and we're going to put a plus on the lower abs. I think this visual does a really nice job of demonstrating why that treatment plan, even though it's technically 4 cycles, is not going to be near as effective as if you used 4 cores. So we drew little arrows right here so that you can see that if you put that plus straight across, that you are going to be treating this area here and this area here, which is outside the wall of that natural oblique line, and so that's really just a wasted treatment area. But more importantly, you're going to be missing this tissue down here as well as this tissue down here. So what can result is a look of an ice cream scoop indent with 2 little fat pads left over, which clearly you are not wanting to achieve for this client. Same thing on the lower abdomen. If we just put a plus applicator straight across and did not follow the natural taper of the fat pad, we would be missing these 2 little peaks, and we'd also be placing the center of the applicator over where she has a deficit of fat. And we all hopefully know that CoolSculpting is designed in a way that the center of the applicator gets the most fat reduction, and then it feathers or tapers out towards the side, so this would be a very ineffective treatment plan for this client. So now it's applicator choice. Do we need the plus? Do we need the core? Do we need the petite? This is where I want to reiterate that sometimes virtually, it can be a little bit deceiving. I think if you look at that original photo or the one on the left, you might think that this woman needed pluses, but we can definitely see in the photo on the right, if we used a plus applicator, we were going to go well outside of that oblique border, in fact, off her body, so the plus applicator was overkill and it was too large for her. So we were able to use the Cool Advantage core both on the lower abdomen and the upper abdomen. So here is the treatment plan. It's important to note that overlap is really, really important, but overlap isn't always the same on different parts of the body. You can see that for her, on her upper abdomen, much more of that bulk of that fat is kind of in the center, and so that healthy overlap is just going to serve her well. Juxtaposed to that lower abdomen, she doesn't have a ton of overlap on that center part, and you can see she has that clear deficit, and the majority of the tissue and the fat is really sitting more closer towards the oblique, and so that's why less overlap is going to be appropriate with this particular treatment plan. So here's our client 16 weeks after a single round, and then 16 weeks after a second round. So you can absolutely see that the size of the donut, the volume of that fat pad has shifted nicely. As we mentioned before, we did not treat the lower peak as aggressively as we could have by placing that applicator lower, and I think this is a really nice visual to say, guess what? It didn't lift up that much. But again, what she was wanting was to flatten out that lower piece, which is exactly what we achieved. We often draw circles for our clients. As a CoolSculpting expert, you look at bodies all day long. You are well aware of what a 20% changes, a 40% changes, and sometimes you really just have to hone in on the before and after photo for the client so they can really appreciate the results that you are able to achieve them. So we often talk about just that fullness and how much fat is filling in that circle, and then also looking at and appreciating the difference in the negative space or the black space. So you can certainly see that 16 weeks after one treatment, she has about a fingerful of black space, where in this photo, when I put my one finger up, I'm clearly touching or even going over that line a little bit. And 8 weeks after the second, we can see that it's much, much more dramatic. Again, as an expert, you could look at these very easily and see that she achieved a nice result, but we want to make it easy for our clients to really hone in on the areas that we did treat so they can be just as excited as we are. So this one I think is absolutely outstanding. I love it. I think the circles serve us very well in this scenario. Again, looking at that black space and just seeing the fullness and the prominence of those peaks. 16 weeks after one has reduced nicely, and then 8 weeks after a second has reduced even more nicely. Fortunately, if you're using a Mac or a photo finder or pretty much any program, you should be able to make circles and then simply copy and paste them so that there's no distortion, there's no, this circle is bigger, this circle is smaller. It's apples to apples so that the client can really gain the appreciation for the result that you achieve for them. We'll just walk through a few other photos. So here is the client 16 weeks after the second treatment and then 16 weeks after the first treatment. So again, you can see how much more dramatic it gets when you do more treatments. I think this is really important not only to show the client, but also to show prospective clients, because we're always really incentivizing people to do 2 rounds. We always give the analogy, it's like having a red house and wanting a white house. If you put 1 layer of paint on it, you're gonna have a pink house, so you're moving in the right direction, but you're not completely happy or thrilled with the results, and sometimes 1 round can be a little bit underwhelming, so we are always coming out of the gate suggesting 2 rounds, and if someone opts to do 1 round, that's okay. We just make a note of that, and we also really stress to the client that the result is gonna be much less impressive if they are only removing 20% of their fat versus getting closer to a 40% reduction. We go as far as to actually suggest that people do 1 area twice versus multiple areas once, because we believe if we get them a really transformative change like this client here, that she's going to be thrilled and she will at some point be willing to move on to those other areas. So we certainly hope that was helpful. Again, it's Jess at Bodify Academy. If you have any questions, reach out to us, but happy assessing and happy freezing.